right, let me know. Who has wine in the audience? Hold it up, hold it up. Woo! All right, because we're going to be doing some whining. I mean, you'll be doing that, I won't. And we'll be doing some gyning up here, which makes it sound like I'm going to be live streaming my gynecology appointment with 3 doctors, which is only half true. We're going to live stream this. There are going to be 3 doctors here, but this is not my gynecology appointment. It's yours. All right, guys, should we get the gyners up here? Yeah. All right, guys, to save us time, I want to have each of the doctors introduce themselves. My good friend, Dr. Shepard, why don't you go first?
All right, is everyone here? Woo, woo. Hey, BlogHer Health 2019, we are in LA. So excited to be here. I just jumped off a flight and literally ran down the street, but I'm here. But I am Dr. Jessica Shepard. I am a OBGYN, gynecologist, women's health expert, and I practice in Dallas, Texas.
All right. Dr. Wright, go for it.
I can't follow that. I'm Dr. Kelly Wright. I'm a minimally invasive gynecologic surgeon here locally at Cedars-Sinai Medical Center. And thanks for having me.
Woo, minimally invasive.
My name is Thaïs Aliabadi. I'm a gynecologist at Cedars-Sinai. I've been in private practice for almost 18 years. And I was told to say a fun fact about myself. I married my first date, and I've been with him 27 years, and we have 3 little girls.
Wow. Imagine if you married your first swipe right. All right, guys. All right, we're going to get into some real doctor stuff now. You guys ready? Ready. So, what potential harm could women face from undiagnosed STIs? Dr. Shepard, why don't you start off?
Yes, I think that this is one of those like fear factor moments when people want to ask in the office, but then they don't ask. But my recommendation is you're the protector of your pelvis. So only you can do what's best for it. So unprotected STIs that you don't know about can really affect things such as your pelvic health and also your fertility. So there are STIs, specifically like chlamydia, that can affect your actual fallopian tubes if it's undiagnosed, untreated, which can lead to infertility. So making sure that you get STI checks annually, whether you're married or single. And also if you change a partner, making sure that you have a clean slate and bring some papers to the table. Be like, this is my STD check. What about yours? Got to see paper, right?
All right, so a pelvis protector.
Yes.
We can do that. Dr. Wright?
I think a lot of the patients I see have chronic pelvic pain, and some of that pain comes from prior sexually transmitted infections, specifically chlamydia. So I agree, be your own advocate, get tested when you want to get tested. And if you have concerns that there are long-term effects, then seek out a gynecologist who might want to do a laparoscopy to look inside. When we perform surgery on women who've had chlamydia in the past that's been untreated, sometimes we see what are called adhesions, which is scar tissue, which can close off the tubes or stick the organs to each other. And so sometimes those things need to be treated both for pain and for fertility.
Dr. Aliabadi?
I think the most important thing to realize is that men and women get diagnosed with STDs at the same rate. However, there's a huge difference. When we catch STDs, we have long-term complications that they don't necessarily have. That's the most important thing. The reason for that is the vaginal mucosa is very thin, so bacteria and viruses pass through very easily. For men, the skin on the penis is very thick, so it protects them more than, it protects, the vagina protects us. Number one. Number two, a lot of these STDs give us vaginal discharge. That discharge to most women is completely normal, right? They think it's a yeast infection, it's bacteria, they don't even think about it, or it could be just normal. The other thing is we get pregnant. If you have an STD and you get pregnant, then your fetus can get infected. They can have deafness, blindness, hearing loss. So a cascade of complication that comes with that. The most important thing is what these guys were talking about with gonorrhea, chlamydia. When you have it for many years and it goes undiagnosed, you can have blockage of your tubes, you can have infertility. It can really affect your future fertility. With HPV, undiagnosed, no symptoms, you can just show up with cervical cancer. So those are the long-term complications.
That was not scary at all. I feel like I am scared.
And also, it's easier for men. That's a shocker. All right, guys. So as many of you know, or may not know, it's Cervical Cancer Awareness Month. Let's do a cheers for that. Woo! And these doctors are at your cervix to answer any questions. I just really wanted to do that cervix pun.
At your cervix?
Yeah. You guys have heard it so many times, right? I'm sorry, it's the wine talking that I'm not drinking. So what test offers the best protection against cervical cancer, Dr.
This,
Shepard?
I think, is maybe like trivia night. We should do trivia night. But a pap smear, which is what we go usually to get annually, is for your cervix, not your ovaries, not your uterus, just your cervix, at your cervix. And so what that is testing for is abnormal cells on the cervix or possibly precancerous cells, which could change to cancer, and in effect it would be cervical cancer. So the best thing that you can do starting at the age of 21 is to get your pap smear started, but at the age of 30 through 65, making sure that you get your pap plus your HPV together, because that's really going to determine any cancer risk. And I'll let the other two explain more about HPV and why it's so important to get it inclusive with your pap.
So when you turn 21, have a drink and
then go for your
get
pap.
your pap smear. Kind of like this, without a pap smear. Okay, so now we're going to talk about the best topic ever, breast health. I myself am a breast cancer survivor. So when I had my first mammogram, the technician said to me, "Your boobs are very dense, but perky." And I said, "Is she calling my boobs stupid but cute? Thank you so much." But Dr. Shepard, why don't you tell us a little bit, what does breast density actually mean, and what does it mean for breast screenings?
So when they specifically talk about density, so we all know that breast tissue has a lot of, we like to say adipose tissue, but that's just code for fat, which is fine. I mean, it's fat tissue and it provides milk for babies and other things and pleasure. Oh, we're not going there yet? Okay.
Well, another time.
When we look at breasts and we talk about specifically mammograms and looking for breast cancer, does everyone know here the risk of breast cancer? In a lifetime, that will be 1 in 9 women will have breast cancer. So it's very important to know that risk. But also when we're talking about dense breasts and perky, such as yours, is that changes how we're able to image that tissue. So dense breasts are actually sometimes a little bit harder to see some nodules or any issues in the mammogram that might allude to possibly breast cancer.
Okay, Dr. Aliabadi, would you like to add anything?
Yeah, I was along the same lines. Our breast tissue has fibrous tissue, glandular tissue, and fatty tissue. When you have more of the fibrous and glandular, you're more dense. When you have more of the fat, you're less dense. When you get your mammogram reports, the radiologist always makes a comment about your density. It's either fatty, entirely fatty, it's fibrocystic, fibrograndular changes, heterogeneously dense or extremely dense. 40 to 50% of us fall into the last two categories. The reason it's important, 2D mammograms, which are the traditional mammograms, these mammograms usually, it's just one X-ray. They basically squish the breast tissue and they get one image, and the dense areas in that image appear white. So it's very difficult for a radiologist looking at a dense breast on mammogram to say, here's cancer, because they can't really see it. Now we have a technology, for those of you guys who don't know, it's a 3D mammogram. The Genius Mammogram by Hologic is a great one. It's FDA approved. Almost every state has it. You have to ask your gynecologist for it. Why? Because the 3D takes a 3D image of your breast, and instead of the radiologist looking at one image, he can flip through images 1 millimeter deep and look at these lesions. So cancer, 25 to 50% chance that your cancer will get diagnosed better, improved diagnosis of cancer, earlier diagnosis. You can use it on any kind of breast, and basically it's super accurate and the images are clear. So I think that's the take-home message, that now we have this 3D machine available.
Great. So, Dr. Shepard, what would you say to women who are afraid of the discomfort that you have in mammograms? I think the technical term is ouch. Like, what do you say to them?
I think sometimes it's a little bit more than ouch. But the mammogram, I think even for the pap smear, women come in and they're like, oh, I'm so scared of the pap smear. You know, I like to put things in perspective, say. And so if it's something that is screening for cancer, which can really affect your life, not only your life, your family's life, potentially your children's life, is that kind of like when you're picking out stilettos, you're like, pain is gain, right? You know, stilettos aren't always the most comfortable, but they make you look really good. But if you're willing to go through a possible squish of a breast or a speculum exam to get your pap smear to detect for cervical cancer, sometimes those things, when you put it in perspective, just makes it a little bit more valuable to you for your time. And sometimes that time can be anywhere from as little as 20 minutes to 3 minutes, depending on what testing you're getting. But I really do see that if you invest in your health, I really tell women, if you're here to invest in your health and leave a legacy for your health, then these are things that you may have to do. So, you know, stilettos, pap smears, same thing. I think they sound similar.
Sort of, yeah.
Right?
Listen, I mean, it's just a few seconds of squeezing. Yeah. That's what she said. Okay, ready? So, switching topics, after some wine and gyne activity, some people get pregnant. You can also get pregnant without wine. So, we've all heard that premature birth rates are on the rise. Are any tests available to show if a woman is at risk for giving birth prematurely? Dr. Shepard?
You want to catch that one? So premature deliveries or premature labor. So I actually do minimally invasive gynecology, and that's usually what I do, but I sometimes see pregnant patients. But the FFN, so that's a test that actually Hologic provides. So Hologic actually is the largest women's health company, so they cover anywhere from breast to cervix to pregnancy. And the reason that's important is because they're really invested in women's health. So if someone comes in and they, you know, labor and delivery and they're like, I'm having preterm contractions or I feel pressure, this is a simple test that we can offer to these women because it has more sensitivity to be able to detect if that woman truly is going to go into labor, usually within the next 24 hours. So what we like to do is it's just a little swab, again, requiring a speculum exam, a little ouch, right? But you're gaining information. And so it's called the FFN. So tell all your pregnant friends about the FFN test. Or if you get pregnant tonight, right, after the wine, then this is something that might come up.
It's a women's conference. It's going to be very difficult.
In conversation. I'm just giving you tips. Get your STD checked. Then when you get pregnant after tonight, get an FFN. Only if you're having preterm labor, but not immediately. Yes.
Okay, so we've got some good health questions that our editors got online. So, Dr. Wright, this is for you. How does a woman know if her period is too heavy, and when is it time to talk to your doctor about it? And for women not seeking hormones or hysterectomy, what can they do to treat heavy periods?
I think there's a lot of us with really heavy periods out there, and so many women come to me and they say, oh, I just thought it was normal. I think if your periods are so heavy that it's preventing you from participating in activities, making you go home from work, preventing you from traveling, or causing you so much pain, again, that you have to do the same things, that you're not going to activities, staying home from work, that is not normal, okay? And if you notice that your periods when you bleed, for example, if you soak more than 1 pad an hour is a very common metric that gynecologists use. That's too heavy. That's when we get concerned that you're going to become anemic. That's when we would tell you to go to the emergency room because you might lose too much blood. So I see a lot of you shaking your heads like, oh no, this might not be normal. And the person you see, your primary care doctor or your OBGYN, might tell you that's normal. And if you're not comfortable with that answer, if you're really missing out on life, seek another opinion or another physician who will take you seriously. It is never wrong to get a second opinion, okay? We are never offended by it. And frankly, if my treatment plan doesn't work for you, I want you to be comfortable with somebody else's treatment plan that does work for you.
You can get 3 opinions right up here and mine for a 4th if you want. So, Dr. Wright, what advice do you have for women who feel uncomfortable talking about women's health issues with friends and family? Like, where can they get this info from, and how can they approach talking about it?
I would say tell your friends and family. So I think when women start talking about things, they realize they share a lot of the same issues and then can get advice and share physicians who can really help them with those issues. So for example, I see a lot of women with pelvic organ prolapse, okay, and that's where sometimes over time the GYN organs can come down through the vagina. About 20% of women across the board will have it, no matter what kind of experiences you've had. And I see patients who say to me, am I the only patient you've ever seen who has this? And I say, no, 1 in 5 women are going to have this condition. So when you talk to other women, you can really find that these conditions are extremely common. And we always hesitate as physicians to say, go online and do some doctor Googling. But I think it's important to be educated about what's going on with you. A good place to start is different hospital websites. Cedars, for example, has a blog with different discussions about different conditions. Individual physicians' websites have articles about certain conditions, so that's always a good place to start. That's pretty legitimate.
Great. Just to piggyback on that, just to give a little bit of info, since this is not about wine, it's gyn as well. So I guess I'll talk about gyn. But just recently I did a campaign with Erin Andrews, who did let everyone know, which I'm so glad, that she did have a bout with cervical cancer. And so what we discussed was, she went for her PAP every year. And, she went the next year and did have cervical cancer. But even in that, with someone who has so many resources, she even sought a second and a third opinion, even after talking to her doctor. So it's always okay to get another opinion, a second opinion, a third opinion. But good websites when we're talking about bleeding, a good one is changethecycle.com. And for cervical cancer, which talks about PAP plus HPV together, and you can also see a little bit of Erin's story as well there, is changethisStat.com. So there's a plethora of information out there. Make sure once you go to Dr. Google, then you actually go back to the real doctor to discuss what Dr. Google said, because many times they will give you, Dr. Google likes to give like the most horrible pictures ever. And then you come to us and you're like so scared, and we're like, it's okay. So make sure you confer with Dr. Google if you would like to, but also come back to your real doctor and let them know what he told you, or she.
Great. All right. So have a drink, talk to your friends, go online, but see doctors for real to ask them. So I think we all want to give women the tools to kind of own their own happiness, make their own choices. So one person wrote in, and Dr. Aliabadi, this question is for you. I'm starting to notice that my skin isn't what it used to be. What are the best treatments you can recommend for skincare?
I'm not a dermatologist, but I can tell you about skincare. So I always say start with lifestyle, right? Exercise, hydration, stay away from the sun, take care of your skin. Eat healthy, that's step number 1. For patients that want to prevent aging, we always recommend vitamin C, retinol, or Retin-A. For some of you, you can get it over the counter, or you can have it as a prescription with some alpha hydroxy acid. For patients who have sun damage over time, then there are resurfacing lasers that they can use. They can have peels or microdermabrasions. In my office, for patients, as you get closer to my age and you start getting lines, I use the Temperature machine in my office. Basically, it's a radio frequency machine. You can use, this device works really well. What it does, it heats up the skin for a period of 5 minutes. That heat at 39 degrees Celsius for a period of 5 minutes stimulates collagen under the skin. So it has no downtime. You can do it on any type of skin, so you don't have to worry about burning someone's skin. The patients can leave. It's very well tolerated. It almost feels like a stone massage on your face. And it really helps stimulate collagen, and it helps tighten up the skin. But there are a lot of options for different skin types.
Thank you. So as women age, this is another question. We all notice changes down there. I think they mean the vagina area. And from what we've read, it seems normal, but wondering if there are procedures designed to combat some of these new issues women encounter as they age. Dr. Aliabadi?
So this is near and dear to my heart because so many of us are ashamed to talk about our vaginal dryness, painful sex. These are topics that nobody ever talks about. Patients are even embarrassed to bring it up with me. So unless I ask, sometimes they don't talk about it. Before 2014, the only options we had were lubricants or use estrogen. Estrogen is messy. People don't want to use it. It's expensive. You have to do it twice a week for the rest of your life. It's a big commitment. As of 2014, and it amazes me because so many people don't know about this, gynecologists have never heard of it. We have a laser called Mona Lisa Touch. It started in Italy. Have you guys heard of it? It's amazing. I love my machine. I have a lot of lasers, but this one is like my baby. It changes people's lives. What it is, it's a CO2 laser, fractional laser of the vagina. It takes 5 minutes in the office. It's painless. It has no downtime. The first year, you do 3 treatments 6 weeks apart. Some patients may require a 4th or 5th treatment, but usually with 3 treatments, they're done. They don't have to do anything else. If they've had breast cancer, it has no hormones, 0 risk. Then after that, just once a year, they get this vaginal treatment. It makes a huge difference. As we get older and we go through menopause, the vagina, we lose estrogen. As we lose estrogen, the vagina, the lining becomes thin. Just like our skin becomes thin, the vaginal lining becomes thin and stiff. So the CO2 laser, the symptoms of vaginal dryness then would be itching, burning, painful sex. It gets very uncomfortable. Some patients, 90% of patients feel better after the 3 treatments. I've had patients after the first treatment, they feel 70% better. So it's an option, it's important for patients, and nobody knows about it. That's what's shocking to me. We've had it since 2014. I've done hundreds of them, but I have doctors who tell their patient, or my patient, don't do it, you'll get vaginal cancer. There's no such thing, it's very safe, it's FDA approved. So, yeah. That's it.
In addition to Mona Lisa, so I offer that as well. Patients love it. It also helps with stress urinary incontinence, so bladder leakage, urine leakage, but also there's radiofrequency spa day for vagina through Temperature, Vitalia, which I offer in my office as well. So there are various different types of things that you can do for the vaginal space. Book an appointment on your birthday for a vaginal spa day with your friends. I'm sure they will come with you. Maybe not in the room, but they might want one as well after they see this. But Mona Lisa Touch is great. And I think it also works for women with vaginal dryness and stress urinary incontinence.
Why did you point at me?
I didn't mean, I was poking your breasts.
I mean, I'd admit it, but I don't have that. So we've talked about boobs, we've talked about cervixes, we've talked about vaginal dryness. So we're almost done. So one final lightning round, guys. What is the GYN tip or takeaway that you want this audience to walk away with? Who would like to go first? Dr. Wright?
I already said it once, but if you present your symptoms to your doctor and your doctor doesn't take them seriously and says that it's normal, get a second opinion.
My takeaway for tonight would be really inner health, overall health really affects your pelvic health. And so if you want to create a legacy of health, make sure that that includes your pelvic health. So making sure that you go to your doctor, have a great relationship with your doctor. If you find that you're not vibing, you're not giving information, you're not asking questions because you might feel a little bit embarrassed or scared, that might mean that you might need a new doctor, because we want the conversation to be similar to what we have up here, and that you would feel comfortable and that you will not be embarrassed, because you should not be ashamed of your pelvis. You should be empowered by your pelvis. So make sure that you have that type of relationship.
I would say for me, there's a famous quote that says, take care of your body. It's the only place you have to live. So for me, eating healthy, exercising, keeping yourself well hydrated, reducing stress, staying away from bad habits, screening your breasts, and going for your checkups once a year is the ticket to health.
Thanks, Dr. Aliabadi. Okay, guys, that was the best gyne appointment ever, right? Let's hear it for the 3 doctors. Woo-woo! They're going to be here just milling around, waiting to give a first, second, and third opinion. And again, I'll give your 4th opinion if you'd like. And thank you, guys. All right, BlogHer Health 19. Woo!